Over to you, Dr. Pruthu.
Thank you, ma'am. I mean, it was a bit overwhelming to hear that introduction. I mean, I am also like I learn by teaching, so I enjoy doing this. Um, Saying that, I'll quickly start the session. Maybe so there are too many components to cover. So what we'll do today is we'll have a session in designed such a way that we'll have some theory sessions where we will be um, understanding the concepts of data analysis, and then we'll go back and use the um, JAMOVI software to run this analysis what we learn during the session. So first of all, I want you to sort of download JAMOVI in your laptop. I'll just show you how to do that so that you can also practice. For example, you do JAMOVI, type JAMOVI on your Google Chrome. It takes you to a option called JAMOVI Open Statistical Software for Desktop and Cloud. You can click on it, and then you need to click on JAMOVI Desktop. Click on JAMOVI Desktop. Once you click on JAMOVI Desktop, please see this navigation. I went to JAMOVI, clicked on JAMOVI. Then there is JAMOVI Desktop. I clicked on JAMOVI Desktop. And within that JAMOVI Desktop, I have an option called 2.6.44 solid. I want all of you to download this solid and not the current one. Just click on that solid. Once you click on that solid, the download will start. Okay. For example, when you click on the thing, download has already started. Okay. I'll just stop the download. So you can just download it. Just put it for download and nothing more. Just put it for download. And then we will continue with the session on summary statistics. So can everyone confirm whether you are able to download it or not in a chat box? Maybe take 2 to 3 minutes and just confirm that whether you are able to download it or not. And it needs to be downloaded on your laptop. If you are using your mobile phone for listening to the sessions, I strongly recommend you use your laptop and do it hands-on rather than just listening to it. Maybe take 2 minutes and confirm whether you are able to download or not. Put it in a chat box whether you are able to download. Are there any challenges or you need any additional support? Task is to download the JAMOVI software into your desktop or a laptop, whatever you are using. Okay, fine then. We'll start the session. Now you need not worry about JAMOVI downloading and other things. Let us start the session to understand what we need as a concept, what we need to have for using this JAMOVI. So is my screen visible? Someone can confirm whether it's visible or not.
Yes, it's visible.
Yeah. Okay, fine then. We'll start. So this session is all about summary statistics. Basically, what I'll be doing is I'll be giving a overview of the statistics, and then we will move to the JAMOVI as I discussed. What is summary statistics? Let us understand this in detail. Summary statistics. When I say summary statistics, it means that it's a statistics applied to only the samples or the individuals whom you have included in your study. Okay, what does it mean? We'll discuss. So what happens in a research? You always have a research design. You go and collect the data and you come to the level where you want to analyze data. When you think of analyzing data, there are two things. There are two things which comes into play. One is to summarize your own sample whom you have collected. Okay. For example, you are thinking of assessing the, last time we have discussed this. For example, if you are thinking of knowing the prevalence of tobacco use among oral cancer patients, what you will do, you will select some patients through simple random, and then you will try to summarize it for that samples. Okay. Say out of those whom you have included, say you have included 200 people, out of them 20 were using tobacco. Then you will say 10% is the prevalence of tobacco use among those who have oral carcinoma. Okay, just an example. But there may be much more than 200 patients who have oral cancer, right? We don't know whether it will be same 10% in everyone. As I said, we have a study design. We go and collect the data, and then we try to analyze the data. When you think of analyzing a data, we have two things. One is summary statistics. The other one is inferential statistics. Okay. So what is summary statistics? Let us understand what is summary statistics. Summary statistics is nothing but measures what you get using only the sample which you have collected. Say 200 oral cancer patients, we are looking at tobacco use, 10% among them. The 10% is summary statistics. But if I am trying to extrapolate it to the whole of the population of the oral cancer patients, from where I have drawn these 200 individuals, when I'm thinking of extrapolating my findings to them, that is inferential statistics. First, let us understand the summary statistics. Then we will move to the inferential statistics later. Okay. When it comes to summary statistics, we have several measures which we use. People talk of rate, ratio, mean, median, frequency, percentage, so many things. This lecture is to make you understand when to use what measure to use for what variable, and how to present it. Let us understand it in detail. So when we go for a data collection, we have variables. For example, age, sex, blood group, height, temperature, all these things are variables. What we do, we collect the values against these variables. What is the age of the patient? Okay. What is the sex of the patient? We collect the data against these variables. We measure or we observe and we collect it. Okay. So variable is that for what we are collecting the data. Data is the values are nothing but which comes for each of these variables. Basically, what are variables? It varies across the study participants. It's not constant. Everyone will not have the same thing. It varies. What varies? The values varies. The data varies. Okay. So when it comes to variables, there are several classifications which you see. You would have heard all these things when you present it to your scientific committee. So we have several of these classification, right? When you go to your ethics committees, you have like several things asked for. Whether what type of variable it is, qualitative, quantitative. Sometimes they ask whether it's an independent variable or a dependent variable, exposure versus outcome variable. So many classifications, right? Highly confusing. But when it comes to data analysis per se, let us follow one type of classification of variables. How we are going to summarize data depends on one type of classification, that is basically whether it's a qualitative or a quantitative. Let us understand the types of variables before we jump into how to summarize each of these type of variables. So when it comes to variables, for data analysis per se, I would ask you to classify it as two major components. One is qualitative and the other one is quantitative. Anyone, what is qualitative variable? What is quantitative variable? Any idea? Just drop in the chat box quickly. I want all of you to be involved, not just a recipient. Just quickly, what is qualitative? What is quantitative? Just drop in a chat box, or you can unmute and speak. Quantitative can be a measurable number. Okay, good. What is qualitative? So qualitative variables are basically those which can take some categories. Say, for example, which district you come from. Oh, no. Very good. Sevatal, very good. Qualitative is about human experiences and involve open. Yes, very good. I wanted this. I was waiting for this. Again, when it comes to variables, this is difference. Quantitative measured as in a value and qualitative is experience. No. Okay. So those are quantitative studies and qualitative studies. Here, what I'm telling about quantitative. I mean, this is all coming from a quantitative studies only. There are two types of variables, qualitative variable and quantitative variable. Qualitative variables are something like your exact quality, what you are measuring. For example, which district you come from, which sex you are, which blood group you have, which color of shirt you are wearing. These are qualitative variables. These are basically you fit into some category. You have some sort of character. Those are qualitative variables. And within qualitative variables, we have something called nominal variables and ordinal variables. What are nominal variables? There are categories which you fit into, but there is no classic order within these categories. For example, which blood group you have. There is no order in this, but stage of the cancer, there is an order in it, right? There also you have categories, here also you have categories, but there is some sort of order, staging of cancer. Okay, socioeconomic status, there is a order there. Okay, say anemia. Okay, mild, moderate, severe, there is a order there. Whereas in other kind of a qualitative variable, nominal, there is no order. Blood group, district, sex, there is no order to it. These are all qualitative variables. Some have inherent order in it, some doesn't have a order. Okay, whether you smoke, yes or no, there is no order in it. That is a nominal variable. When you have death, yes or no, that is a nominal variable. These are basically some categories which are assigned to the individual. These are quality of a individual or a quality of a individual's living. Okay, so these are qualitative variables. Then what are quantitative variables? Quantitative variables are basically exact measurement of the quantity. Okay, say for example, you are measuring the weight, height. These are quantitative variables. Within the quantitative variables, there is again a classification into two: discrete variable and a continuous variable. The difference between discrete variable and continuous variable is both we are measuring a quantity. Okay, whereas in discrete, what we are measuring cannot have a decimal value. In reality, it cannot take a decimal value. For example, number of episodes of diarrhea, okay, or number of cycles of chemotherapy, number of cycles of radiotherapy, number of children you have. All these things are always a whole number. In reality, they cannot take a decimal point. Whereas continuous variables are something which can take a decimal point. In reality, can take a decimal point. Okay. For example, age. I can measure it with certain level of precision. In reality, it can take a decimal point. Say height, it can take a decimal point. BMI, it can take a decimal point. Okay, so all these things are considered as continuous variables. So just remember this. In terms of variables, we have qualitative variable and a quantitative variable. I don't want any one of you to get confused with a quantitative studies and qualitative studies. Totally different context. I am talking about only the quantitative studies now. Quantitative studies. Within this quantitative studies, I am talking about variables. There are two types of variables: qualitative variable and a quantitative variable. Qualitative is something which fits individuals into certain categories. Okay. Within qualitative, we have two types: nominal and ordinal. Nominal There is no order within those categories. Ordinal, there is an inherent order within those categories. When it comes to quantitative variable, we are exactly measuring the quantity of something. Okay. So within this quantitative, you have either discrete or continuous. Discrete is when you have whole number as the quantity measured. In reality, it cannot take a decimal. There cannot be 2.5 episodes of diarrhea. Okay. So it cannot take a decimal point. Whereas continuous, it can take a decimal point. Okay, now I'll ask some variables. I want you to quickly drop it in a chat box and tell me what type of variable it is. Okay. Okay. Am I audible? Yes. Okay. What about hemoglobin value? What type of variable it is? Hemoglobin value. Within this classification, what type of variable it is? Very good. Excellent. Anbarasan says continuous. Excellent. What about systolic blood pressure? Systolic blood pressure. It's a quantitative. Very good. So just understand. Again, there is a merit in everyone who is telling whether it's a continuous or discrete. The way we are measuring it is discrete. Say, for example, 15, 20 years back, the sphygmomanometer, manual sphygmomanometers could give only the blood pressure at a precision of 2 millimeter Hg, right? It couldn't give 119, 117, 115. It was always an even number. That is because those were not very precise. With the digital, we have even 1 millimeter Hg. But if you go for further precision, even we can get that in a 0.1 millimeter Hg. Just because we are not measuring with that precision, that doesn't become a discrete. See, just understand this concept. How much ever precision you do for number of episodes of diarrhea, you cannot have a decimal point into it. But if the precision increases in case of measuring the systolic blood pressure, then it will be a continuous in nature. In reality, it is continuous. It's not about how we are collecting it. In reality, whether it is continuous or not. In reality, whether it can take decimal point or not. Say, for example, I'm going and collecting a age in years, whether it's a continuous variable or a discrete variable. Quickly, age in years. Perfect. It is a continuous. Yes, Anbarasan, age in years. I'm collecting it as age in years just because I'm not able to precisely collect it. But in reality, it can take a decimal point. Just don't get confused with discrete and continuous. There is a minor difference here. It's not about how I am collecting it. It's about in reality whether it can take a decimal point or not. Is that okay? What about?
Sir, it
what
is
about?
not clear for me, sir. I didn't get it.
See, it's not all about how you are going and collecting it. Just because you are not able to collect it precisely, the age, you will say, I'll collect the age in years. So it will always be a whole number. It's not all about how I collect. In case, if given an opportunity, whether I can collect it more precisely in terms of with the decimal point.
Yes. Okay, sir. I agree.
Okay.
Understood.
But whatever I do, number of episodes of diarrhea, number of cycles of chemotherapy, number of cycles of radiotherapy, number of children you have, these can never take a decimal point in reality, right? This is a difference between the discrete and the continuous variable. It's not always about how we collect it. It's more to do with in reality whether it can take a decimal point or not. The same logic applies to the systolic blood pressure. Okay, let us move now. We have discussed these things: quantitative variables, discrete, a variable which can only take the certain values, usually a whole number, it's a count. Continuous variable which can take any value. Okay, we have discussed this with a decimal point. Whether it can take a decimal point or not take a decimal point is what determines whether it is a discrete or continuous. In terms of qualitative variable, we have already discussed in detail. There are two types of qualitative variables. One is nominal, where categories are not ordered in an increasing or a decreasing order, but whereas in ordinal, everything is in a order. For example, severity of pain, no pain, minimal pain, moderate pain, severe pain, grades of malnutrition, Apgar score. All these things are basically in a order. Okay, these are also categories, but they are in a certain order. Now let us move to how to summarize the data. Let us talk about first how to summarize the quantitative data. Then we will move to the qualitative data. As this is a diverse group, I'll not get into too much of statistics of it. Instead, I'll get into what needs to be done when kind of a thing. I'll not go into why this or anything. I'll just give you a overview on how to really handle this data, which is much more important than understanding the theory behind it. Okay. So when it comes to summarizing a quantitative variables, we use either one thing we use is measure of central tendency. Okay, what is this measure of central tendency? It is nothing but a one value which can summarize the whole of my sample which I have collected, whole of my observations which I have included in the study. When it comes to measure of central tendency, there are several measures. We talk about mean, median, mode, geometric mean, harmonic mean, skimmed mean, too many. The most important thing is when to use what. Okay, let us understand these things a bit so that we are clear when to use what. So the first thing is mean. Okay, it is nothing but average of all your observations. Say, for example, you have 10, 20, 30, 40 years. There are 4 observations here. When you add all these values and divide it by number of observation, that is 4, you get your mean. It is nothing but average. Okay, what is median? You basically arrange it in a ascending or a descending order. The value which is in the center or 50th percentile is your median. For example, I have 2, 3, 4, 5, 6, 7, 8, 9, 10 as my values for the observations what I have. So I arrange it in ascending order. That 50th percentile, which cuts into 2 portions, 50% below that value, 50% above that value. Okay, 6 is my median here. And in case if you have an odd number, we go for calculating by putting it in a ascending order. Then you can take 6 and 7 or a middle one. You add those things, divide by 2 and get a median. Let us take this and can you tell me what is the median here in this example? The last one. They have arranged it in a 3, 5, 8, 10, 12, 15. Okay. 9 is the median. And there are basically what it tells. Below 9, there are 50% of my observation. Above 9, there are 50% of my observations. Okay. So this is all about mean and median. We have understood it. Okay. Say we are all here, right? What we'll do, we'll collect the who are all in the course. We'll collect our monthly income and we'll take a average of it. Okay, we'll decide to do a average mean of our monthly income. Is that okay? Fine. When we do this grossly, as we are all in the same profession, grossly it would be something very common, right? Everyone would have a same, almost same, and the value what we get as a mean would represent most of our salaries, monthly salary or a monthly income. Assume that to this course, all of a sudden, Ambani enters. And now if I calculate and we also include him in our calculation, mean of our monthly salary. Once we include him, and if I calculate the mean, what will happen? What will happen? I'm including the monthly income of, yes, someone says, Nitya Priya says Q, outlier. Dr. Kopalu Sweta says outlier. Skew. Okay, can someone just unmute and tell me what does this skew mean? What exactly you mean by skew? Quickly, please unmute and tell. Whoever has put that message, please unmute yourself and speak. What happens to the mean? Can I call Nitya Priya to unmute and tell what does this skew mean? You are right. Can you explain that? Hello? Okay. Pulls the value to the higher side. Data which is not aligning with our objective will be considered as an outlier and it skews the data. The mean is pulled towards one side. Yes, exactly. See, skewing is nothing but just because the Ambani's value is higher and which may be, say, 1,000 times or 2,000 times higher than what we have, automatically the value will pull towards that outlier. The mean will be pulled towards outlier, which means that it may not represent the 33 people who are here. It may not be the representation of us. It may be just a representation of one person's extreme value. Okay. So it skews the mean towards the higher value. So what if I calculate, okay, Ambani alone enters, I calculate the median. What happens? Does it change grossly? Median? Same thing. We'll arrange all our monthly incomes in ascending order, including Ambani's, which will be the last. And then I'll take a median. It will not change much. Just keep this in mind. Just keep this in mind that when you have outliers, when the data is not normally distributed, I bring this new term called normally distributed, your mean gets skewed towards the extreme values, but the median may not get affected much. Keep this, park this in your mind. Okay, let us move to the next. We have seen mean and median, and the other one is mode, which is nothing but a common value. And there are several other types of mean, like you have geometric mean, harmonic mean, which I will not discuss, not really useful in larger health research. Okay, very rarely used, not of much use. I spoke about mean and median, which are measures of central tendency. Now I am talking about measure of variability. What does this measure of variability mean? See, when it is measure of central tendency, I was trying to get one value to talk about whole of my observation, whole of the sample which I had collected, right? But now I am trying to understand, okay, my mean is this, how my data is dispersed, how the values are dispersed across this mean value. Or my median is this, what is the dispersion, how these values are dispersed. Then comes something called range. What is range? The lowest value and the highest value. So if I give my median and lowest value and highest value, I know that, okay, below this median, 50% are there. Okay, my values start from this and will end at this. Then comes something called average deviation, which is from the mean, what is the average deviation of each value. Then comes standard deviation with mean. Again, we'll discuss this. There is something called variance, which is nothing but square of standard deviation. For example, if standard deviation is 10, variance will be 100. Okay, square of standard deviation is variance. These are different ways of presenting it, don't worry. Then there is something called coefficient of variation. What is this coefficient of variation? For example, my mean is say my mean is 40 and my standard deviation is 10. It is nothing but the coefficient of variation is how big is my standard deviation when compared to my mean. So how big is 10 compared to 40? It is 25% of 40. That is your coefficient of variation. These are again the same thing presented in a different ways. So standard deviation, if you are able to get a mean and standard deviation, then you will be able to calculate the coefficient of variation. It tells how big is the dispersion. Next is something called interquartile range, which I'll discuss in detail. Let us take 2-3 things here. One is standard deviation, coefficient of variation, and interquartile range. We'll discuss this in detail because these are the things which are pretty important when it comes to health research. So let us take this example. The mean of the height is 140 and 20 centimeter is standard deviation, while weight is 50 and 50 and 10 is the standard deviation. Which is more variable? Which variable has more dispersion? Can someone tell me? Look into it and tell me. Which has more dispersion? Height or a weight? Which has more dispersion? Which is more dispersed? Okay. Okay, I'll allow another minute for you to respond. Dr. Anbarasan says height. Nitya Priya says weight. Dinesh says height. Any other answers? Which of these things you think is much dispersed? Both a smart answer. So let us understand this. What I'm trying to ask, which is more dispersed? It cannot just a value. For example, height is a larger value, right? 140 centimeter. Weight is a relatively a smaller value. Height can range up to say up to 200. Whereas weight, mostly it remains within 100. Okay. Given that your standard deviation will be relatively higher for a height, the value of the standard deviation is higher. But we always need to think of coefficient of variation. How big is the dispersion is not about the absolute value. Just because height is measured with a higher value in centimeters, that doesn't mean that the 20 is something which is more dispersed. You look into the coefficient of variation. Okay. So what is 20 out of 140? It is around 14%. Whereas in case of weight, 10 out of 50 is 20%. That means the dispersion is more in weight. So always, when you think of any mean and standard deviation, people may ask, right, whether it's normally distributed or not. One of the way to decide whether it is normally distributed or not is if your coefficient of variation, that means if your standard deviation is more than half of the mean, or the other way of telling it is if your coefficient of variation is more than 50%, if your coefficient of variation is more than 50%, then the distribution is usually not normal. Not normal. That means it is being skewed with the outliers, or there is some other pull mechanism which is not allowing it to remain normally distributed. If your coefficient of variation is more than 50%. Okay, just keep this in mind. I'll come to it again. If your coefficient of variation is more than 50%, or the simple way of telling it is if your standard deviation value is more than half of the mean. For example, in weight, if the standard deviation was more than 25, then I am sure that it is not normally distributed. If in height, if the standard deviation is more than 70, I am pretty sure that it is not normally distributed. That is how it is. So what happens when you have a larger standard deviation in relation to the mean value? When you have a larger standard deviation, it is widely spread. Your observations are widely spread. Your y-axis is number of people. X-axis is values. If you see this figure, x-axis is value. Y-axis is number of people or number of observations. So what happens? Your x-axis values are widely spread, and the number of individuals in each of these values will be thin. That means it is dispersed. Okay. When you have a smaller standard deviation, what happens? It all aggregates around the mean value. Okay. This is a difference between spread. When you see a standard deviation, how dispersed is your distribution of the observation, you can easily know it by looking at the mean and also standard deviation. And you are pretty sure that if mean is more than half, standard deviation is more than half of the mean, you are pretty sure that it is not normally distributed. What is this normal distribution is all about? I just don't want you to get too much into it, but just understand briefly. What is this normal distribution? If you draw a normal distribution curve, in case you have 100 observations, say I'll take 200, easy for calculation. If you have 200 observations, and if you put your observations in the y-axis and values in the x-axis, what happens is your mean value will be the one where most of the observations will be. Okay, when you draw a normal distribution, and 50% of the individuals will have their values lower than the mean, and 50% will have more than the mean. It's basically a smooth curve, a distribution curve, where both sides, lower to the mean, the same number of observation, higher to the mean also, it will be same number of observation. So what will be the mean? Mean will be equal to what? If 50% of the observations are below mean and 50% of the observation are above mean, mean will be equal to what? What measure? Can you drop in the chat box? Mean will be equal to what? 50% below the mean, 50% above the mean. The observations. What is the other measure we spoke about? The way which cuts the whole observation to 50% of thick. So it is mean is equal to median. Very simple. So when it is normally distributed, mean will be equal to median. And what happens is when you draw this normal distribution, your mean plus or minus 1 SD. That is, say, let us take that example of height itself. Mean height was 140, standard deviation was 20, right? So my mean 140 plus or minus 20, which is 120 to 160, will have almost 68% of the values. 68% of the observations. Say I have 200 individuals included in my study. 156 will have their height between 120 to 160. Okay. If I go for the same mean plus or minus 2 standard deviation, say 140 minus 40, 100, 140 plus 40, that is 180. 100 to 180 will have almost 95.5% of my observations, or the other way of telling it is 191 observations out of 200 will have a height between 100 to 180. So when someone just gives you mean and standard deviation, they are just basically presenting their whole data about that variable. You will be able to cut into multiple brackets. Okay. So now tell me, just looking at it, now tell me, what percentage of my observations will be below this minus 1 SD? Minus 1 SD. What percentage of the observations will be below this minus 1 SD? Just think for a minute and tell me. What percentage of my observations will be below mean minus 1 SD? This part. What percentage? Excellent. Excellent, Dr. Anbarasan and Dinesh and Kopal. It's almost 15 to 16%. What is it all about? 50% is below mean. And what is there between mean and minus 1 SD? I said it is 68% between minus 1 SD to plus 1 SD. So 50 minus 34 would give me around 16. 15 to 16. To be precise, it's almost 15.8. Very good. Excellent. So with just the mean and standard deviation, you will be able to calculate the cutoffs. For example, if someone has given a mean and standard deviation and you want to consider anything more than 95% as a extreme values, you can easily calculate what would be the value for providing that cutoff for extreme value. Okay. It's an excellent statistical measure, mean and standard deviation. Always mean goes with a standard deviation. Okay. When I'm summarizing, always I go with standard deviation when I'm using mean. Okay. Next comes one more thing called interquartile range. Okay. The other way of cutting the observations. We already saw we have 50 percentile. Okay. That is nothing but median. When we have a median, it cuts into two halves. Within each of these half, I'll cut it at quartile 1. That is, if I have a bread piece, one whole bread piece, I have cut it into half. And within that half, I'm cutting exactly into another equal portions. That is basically, I'm dividing this whole observations into chunks of 25% each. So quartile 1 is nothing but my 25th percentile. Quartile 2 is my 50th percentile. And quartile 3 is my 75th percentile. Basically, if I want to cut into 4 equal parts, I need to cut it 3 times. Right? I need to cut it 3 times. What all I cut? I cut it percentile 25. That is my Q1. Then I have Q2. Then I have Q3. So basically, I'm dividing it into 25 portions of 25% each. Okay. So what happens when I put it in a 0, 25, 50, 75, and 100? I'm pretty sure if I'm able to give my median and values of 25th percentile and a 75th percentile or a quarter 1 and quarter 3, I'll be clearly able to understand where my 50% of the observations are dispersed. That will be between my 25% to 75th percentile value. And basically, I'll be able to think about the dispersion. Okay, the value which has 25% of my observation, lowest 25% of my observation, I can always give that value. Say, let us take this example. Okay, so if in this example, what happens is I know that 25% are below 8, 50% are below 27, and I can even say that 25% are more than 65. Okay. Very good. What is the difference between mean 1 SD and 25% to 75% interquartile range? These are totally different concepts. What does mean and one standard deviation would cover? 68%. 68%. What if 25% to 75% is covering 50%? It is covering 50%. Okay. And when I say mean and standard deviation, if I'm able to give a value from minus 1 SD and plus 1 SD, what I can tell, when I have minus 1 SD value, I can tell, okay, around 15% of the values are below this value. 15% of my observations are below this value. On the other side, I can say another 15% are above that plus 1 SD value. Okay, here median and 25th and 75 percentiles are exact values what I am getting at the cutoff Q1, Q2 and Q3. Okay, there I am deriving it. Here it is exactly what I am getting at 25th, 50th and 75th percentiles. Okay, just think of what percentage it's going to cover. Mean and 1 standard deviation, 68%. 25 to 75, it is cut exactly at 25th to 75. If I exactly want to get the percentile, then what I need to do? I need to get the percentile value of, I need to get a mean and 1 standard deviation percentile. I need to go at, say, 16% would be 16 percentile. And on the other side, you need to go for 66 percentile. 84th percentile. That would give me the exact values of mean plus 1 standard deviation. Here the percentile are totally different. What I'm getting is 25th percentile and the 75th percentile. Okay. So conceptually, these two are different. The most important thing is when to use what. I said mean and standard deviation goes together. Median goes with the interquartile range. Median goes with the interquartile range. The reason is very simple. When I am not able to use mean, when I have extreme values, what happens? If I use mean, the standard deviation and mean will not give me the exact normal distribution curve, which means it will not, mean plus 1 standard deviation will not include 68%. It's not of much use. So when the distribution is not normal, I go for median and interquartile range. And this holds good only for continuous variables. When I have a continuous variable and if the distribution is not normal, I go for median and interquartile range if it is not normally distributed. A prior, when I'm starting the study, I'll not know. After collecting the data, when I try to analyze the data, if it's a continuous variable and if it's not normally distributed, how I'll know whether it's not normally distributed or not? I'll go with the thumb rule. If the coefficient of variation is more than 50%, then I'll consider it as not normally distributed. Then what I'll do? I'll use median and interquartile range. For all the discrete variables, the count variables, I'll go for median and interquartile range, which means that I can use mean and standard deviation only for continuous variables which are normally distributed. Okay, just remember this. You have a quantitative variable, decide whether it is continuous variable or a discrete variable. If it's continuous variable, after you collect data, check for normality. Run your mean and standard deviation. If your standard deviation is more than 50% of the mean, then go for median and interquartile range for summarizing. If the mean and standard deviation is, if the standard deviation is less than 50% of the mean, and it's a continuous variable, present it as mean and standard deviation. Summarizing. Okay. If it's a discrete variable, always go for median and interquartile range. This is the golden rule. Please keep this in mind. Is that okay? Any doubts in terms of summarizing quantitative variable? When to use what? When to use mean, when to use median and interquartile range. Whenever you say when to use mean, it always goes with a standard deviation. Any doubts, anyone?
Pruthu, Arun here.
Yeah, please.
Hi, nicely explained. Very important point you have emphasized, whether the data is normally distributed or it's abnormally distributed. So you clearly explained based on the standard deviation and mean, we can tell whether we should use mean or median. What other implication, whether the data is normally distributed or not? So what other implication it has in our statistical analysis?
Okay. Thank you for that question.
Yes.
Very important one. What implication it has is, I mean, let us go with a step by step. When it is not normally distributed, it's highly likely that you have a very small sample size. Okay. What is this normal distribution? It's all about aggregating towards the mean. When you have a larger sample size, automatically most of our health related parameters fall into a normal distribution. Okay. When it is not normally distributed, one is in terms of summarizing, we use median and interquartile range. And in terms of inferential statistics, we go for a non-parametric measures for calculating the p-values and things. What it does is, it doesn't really take the each value for calculating these statistics. It starts taking some sort of ranking method. So when something is not normally distributed, it's not exactly the data what you have or the value what you have collected will get into the further analysis. It's basically the ranks. You are always measuring it in terms of relativeness rather than the exact value. So I don't say the median and interquartile range and the not normally distributed data is inferior, but I would always strive for achieving something which is normally distributed by having adequate sample size. But in case if it doesn't happen, it's okay. It's okay. But the interpretation has to be a bit different than the way we strongly interpret when we have a median and interquartile kind of a data. Sorry, mean and the standard deviation kind of a data.
Okay. So thanks, Pruthu. So you nicely suggested like one is whether to use mean or median. And later for all inferential statistics, whether you want to use parametric or non-parametric, this will be based on this, you will be deciding, right?
Yes, based on this, we'll be deciding. I'll come to that when I take a session on inferential. So didn't want to overwhelm them with all the other information, but this determines how you really process your data, all your data in future. Once you have first thing is normal distribution. If it's not normally distributed, then the whole analysis plan gets into a different level.
Thanks, Pruthu.
Yeah. So that's it for quantitative variables. Let us move to the qualitative variables. Very simple. When it comes to a qualitative variables, we always do it, right? Frequency and percentages. We tell how many number, what percentage of the total were these numbers. Okay, once defeat coefficient of variation. Coefficient of variation is nothing but what percentage of your mean is your standard deviation. Say you have 20 mean and SD is say 4. Then the coefficient of variation is nothing but 4 out of 20. 4 out of 20, which is nothing but 20%. Is that okay? It is nothing but a relative way of telling how big is my standard deviation when compared to mean. Because it's sort of standardizing, right? If I just start telling that my standard deviation for height is 20, my standard deviation for weight is 10. Because these two measures are totally different. One is measured at 100 height. Weight is measured at 18 tenths. Just because these are larger numbers, the larger number value will be relatively higher. So how to standardize it? One of the way to look at it is how big is the standard deviation when compared to mean. Okay, that gives a coefficient of variation. The example which I took, 140-20, 50-10, which is larger in terms of variability. Definitely 10 out of 50 is larger than 20 out of 140. Okay, that is coefficient of variation. So let us come to our qualitative variables now. Very simple, very easy to summarize. We have some measures. The first thing is we always give a frequency number. How many had, say, how many were smoking among those who had oral carcinoma? 20 were smoking out of 200. The first thing is how we present it. Most of the time we tell 20 out of 200. 20 out of 200 were smoking. So the 200 denominator has this 20 also included. That is my total number of individuals whom I included in the study. Okay. So that is nothing but a percentage what we calculate. There is a bit different one when the denominator does not include the numerator. Say I'll say 20 out of 20 is to 180 was the ratio of smokers to non-smokers. 20 out of 20 is to 180 is nothing but 1 is to 9. Okay, that is ratio. What is ratio? When your numerator is not part of the denominator. Out of 200, 20 are smoking. If I want to take a ratio, what I'll do? I'll take 20 and I'll take those who are not smoking as my denominator. Okay, 20 is to 180, which is nothing but 1 is to 9. I'll present it as 1 is to 9 is the ratio of smokers to non-smokers in my study. Okay, or the other way of telling it is 20 out of 200, which is 10% are smokers, where the denominator has the numerator in it. Numerator is part of the denominator. Then comes something called rate. Rate is nothing but when you have a follow-up studies, when you have a cohort studies, you also have along with this, say for example, I have 20 out of 200 are smoking. That is prevalence at that point of time are smoking. Okay. But say, I'll say that I am taking 200 people, I am following them up for 1 year, and I want to see how many of them start smoking. Okay. Then comes again 10% started smoking over 1 year. The time component is included in the rate, whereas the proportion or percentage does not include the time component. The difference between rate and proportion in a study is that rate has some time component included in the denominator in terms of how we express it. Whereas in case of proportion, we don't have time component. Okay. This is a difference between rate and the proportion. And ratio, we already saw. Ratio will not have the numerator, which is there in the ratio, will not be part of the denominator. Okay. Just remember this. If the numerator is the numerator included in the denominator, if it is not included, it's a ratio. If it is included, then it can be either rate or a proportion. If it is cross-sectional and at that point of time it is being studied, then it is usually proportion, which is nothing but your prevalence. If there is a time component of follow-up included, if the time component of follow-up is included, then it is.
Akash, can you mute others?
So in case of queries,
Please mute. Please mute.
Akash, can you mute?
Okay. If there is a follow-up component included, then it is a rate. I'll just introduce some of the things. Proportion, we already discussed. It is nothing but total number who had the event divided by total who does not have. Okay. Say numerator is part of the denominator. In terms of proportion or a prevalence, we have several types of prevalence. It is nothing but at that point of time, both you get it in a cross-sectional studies. We have two types of prevalence. One is point prevalence and the other one is a period prevalence. It's important to understand this. What is point prevalence? For example, I'm going and conducting a study and I'm asking them whether you have asthma. I'm conducting a survey and I'm going and asking whether you have asthma today. I can conduct this survey over 2 months, but whenever I go to the participant, I go and ask them whether you have asthma today. Okay, whether you have asthma today or currently you have asthma. Okay, then I calculate, I get some numerator, say out of 1,000 people whom I interviewed, 10 on the day of going and meeting them and asking them this question, 10 had asthma. Okay. Then what I say? The point prevalence at the time of inquiry, whether they had it or not. That is my point prevalence. Instead, I go and ask them whether in last 1 month, any time you had an episode of asthma. I'm ascertaining a period of 1 month. That is the day I'm going and interviewing them. I'm giving them a period of 1 month and asking them whether you had asthma anytime in the last 1 month. Okay. Say around 50 people say I had asthma at least once in last 1 month. Out of this 1000, then I'll calculate 50 out of 1000, which gives me 5%. Okay, whereas in the point prevalence, it was just 1%. Here it is almost 5%. Are you able to understand this? Again, I'm going and collecting the prevalence. I'm getting the prevalence itself, whether you have something at this point of time or in a particular period which I am ascertaining. Okay, say 1 month. Say in last 15 days, whether you had it. Okay, that becomes my period prevalence. Both these things are different because most of the time, the point prevalence for an acute event, the point prevalence will be relatively smaller. On the day of you going and interviewing someone having that event will be relatively lesser than him having in a certain period of time. Okay, so why these two are important is because if I go and collect the point prevalence of asthma, I'll not be able to decide whether how big is this problem. I may require some sort of period prevalence, last 1 month whether you had, or last 1 year whether you had any episode. That gives me a better understanding of the burden of the disease for setting my interventions. So these two are different, point prevalence and period prevalence. Classically, when someone conducts a study and goes and asks for a smoking or anything, they ask for a point prevalence, whether you are currently smoking, whether you are currently on alcohol. But you can also convert it into a sort of period prevalence in last 1 year, whether you had any of these things. Then you have something called lifetime prevalence also. You go and ask whether any time in your lifetime you developed this, whether any time in your lifetime you had a episode of asthma. So these are totally a different concept, and based on how you are asking the question, you decide whether it's a point prevalence or period prevalence. It's not about analysis. It's all about how you have collected the data. Okay, so this is important, and I'll just leave this, skip this. Let us go into the rate. We already said you have number of events observed during a time period divided by population at risk. So when it comes to population at risk, you have two ways of doing it. For example, you would take 1,000 people and follow them up for 5 years to see the incidence of diabetes. Once someone develops diabetes, he cannot, again, he's not at risk for developing a diabetes again because he has already developed diabetes. If someone develops diabetes at year 1, all the other 4 years he has been followed up, but he had an event in the year 1 itself. So he's not at risk of developing it. He has already developed. Say for someone, you have wanted to follow them up for 5 years, but someone dies at the end of 1 year. They are not there. So you do some sort of adjustment for these denominators. One is you take all 1,000 and say how many developed over 5 years. That is very crude way of doing. We call it as incidence rate. Okay, or we call it as cumulative incidence. Okay, so the other way of doing it is in terms of incidence rate or a density. One is cumulative incidence. I spoke about it. You take all 1,000 and say that 200 out of 1,000, 20% developed diabetes. Instead, what you can do is you can take individual contribution of in terms of time of each of the individuals. That is, they contributed to the cohort till they developed the disease, till they died, till they lost to follow. And when you do these kind of adjustment, you calculate something called incidence rate or a incidence density. I'll not touch upon it too much because there is a lecture on survival. It will be covered there. So basically, we are presenting it in terms of percentile. Each person we are calculating how many years he contributed, or how many days he contributed, how many months he contributed. Okay, and then we are taking that as a denominator instead of absolute number of individuals as a denominator. That gives us something called incidence rate or a incidence density. Okay, there are two things: cumulative incidence, where number of subjects at the risk of beginning of the period, and we take everyone had a similar risk till the end of the study. Okay, that will give us a cumulative incidence. The better way, in case if there is a lot of attrition, in case there is a lot of death, in case there is a lot of people leaving the study, then you calculate something called incidence risk or a incidence density. Okay, where person time, person years, person months, and person days becomes a denominator rather than the absolute number of persons. Okay, that's it for summarizing the data. We spoke about quantitative, we spoke about qualitative. Now what we'll do is we'll take a common example and we'll use JAMOVI to see how to really summarize the data with whatever we have discussed.